everybody. Welcome to the Medical Errors and the Role of Sterile Processing lecture. This lecture we will discuss best practice methods for preventing medical errors. We will also discuss real-world scenarios where patients were infected due to improperly processed medical devices. We will also discuss the importance of the responsibilities of the sterile processing department and understanding that you have a significant role in preventing medical errors. So as we begin this chapter, I encourage you to take notes, keep in mind the impact of medical errors on the healthcare community as well as the patient. So let's begin. All right, so the definition of a medical error is an unintended or preventable event that occurs during the provision of healthcare and leads to the potential harm of the patient. Now, the problem can occur in the practice, in a product that is used, during the procedure, or a systemic system error. There are multiple types of medical errors. For the purpose of this lecture, we are going to focus on surgical errors, specifically in regards to potential HAIs or even communication errors. Medication errors is incorrect dosage or wrong medication. Now, we don't have any direct contact with the patient, nor do we have access to medication, but that does not mean this is not a very significant type of medical error that can occur. Surgical errors include wrong site surgery, retained instruments, which means an instrument that is left inside the patient after the surgery has concluded. We have diagnostic errors, so misdiagnosis or a delayed diagnosis of an underlying disease. Healthcare associated infections, HAIs, that is multiple different reasons those can occur. For purpose for what we're going to talk about, it is with contaminated instruments. And last but not least are communication errors, so miscommunication between departments. This is especially important for us because even though we do not have direct access to that surgical patient, we do have access to personnel within the surgical floor. And so communication is critical when we are trying to deliver a sterilized set. All right, so here are some causes of those medical errors. Human factors, fatigue, lack of training, that is a big one for the sterile processing department. System failures, poor protocol, lack of standardized procedures. Equipment failure, this is another big one for us in the sense that if any of our sterilizers fail and do not properly let us know that there are problems within the sterilizer, that is a problem for our surgical patient. And again, poor communication and documentation. So everything that you do in the sterile processing department is documented. So there needs to be legible signatures, there needs to be clear communication, and this document also has to withstand court of law in the event that there is a surgical site infection. All right, so some of those impact of medical errors, of course, number one is patient harm and fatalities. That is a big one for us when it comes to the bottom bullet point here, where it's the emotional impact of healthcare workers. So we know that a set that we delivered caused harm to a patient. That is definitely going to impact us emotionally and probably affect future performance. Medical errors also increased healthcare costs, and there are also legal and ethical consequences. So the role of sterile processing in preventing medical errors. So this one is extremely important to us. First, we're going to cover the proper decontamination and sterilization of instruments. So as you go forward with the program and into internship, you will understand how many steps that are taken with decontamination and sterilization in order to prevent those medical errors. Also, ensuring correct assembly of instrument sets, adhering to infection control standards, that's a big one for us as well as reducing risk of retained surgical items and those healthcare associated infections. Now, the role we have in reducing retained surgical items is ensuring that when we create those count sheets, we are adequately and accurately transcribing the instruments that are on that set. So let's say the set calls for 5 cryos, but we put 6. when that operating room staff counts, and perhaps they miss it as well and they only count 5, but 6 were actually used in the surgical field and they didn't account for that extra one, and now that extra one has been left within the patient after it was closed. So making sure that when you have that count sheet, you are accurately documenting the exact number of the instrument and the exact instruments that are supposed to be on that set. Okay, so some related errors to the sterile processing department. Improper sterilization techniques. This could be as simple as using the wrong chemical indicator for the wrong sterilization method. So if we have a low temp, heat sensitive item and we place a chemical indicator within that tray, that chemical indicator is for a high temp sterilizer. It is not going to properly turn because it is not designed for that sterilization method. So we need to make sure not only are the instruments sterilized according to their IFUs, but we're also using the correct chemical indicators and barrier packaging that is compatible with that sterilization technique. Another related error is incorrect instrument assembly. Again, placing the wrong instruments on a tray, not including the correct number of instruments, or including less amount of instruments. Failure to follow the manufacturer's instructions for use is a big one, because if we are not properly sterilizing that instrument according to how the manufacturer tells us, there is a possibility there will be a sterilization failure. We also have labeling and tracking mistakes. Again, everything we do is documented. If we improperly label or track a specific set and there is a issue with sterilization, that information is not relayed to the operating room staff, that is a potential for a medical error. So here's some best practices in the sterile processing department to prevent those errors. Well, first we're going to follow AAMI and CDC guidelines. We will also follow any other guidelines, say from OSHA or even AORN. Staff should be trained regularly. This is a big important one, and most facilities will have regularly scheduled trainings for more up-to-date information as new medical devices come into a facility. The next are quality assurance checks and audits. That is a huge part of the sterile processing department. And again, proper documentation and tracking systems. All right, so this slide includes information from your HSPA manual. This is from chapter 18, I believe, where it talks about FMEA and RCA. So this is the quality assurance portion of how we can prevent medical errors. This is also important for you to know for certification. This has definitely been a few questions that previous students have seen. So you need to be familiar with these two terms. So how do we correct a problem? Well, there's two different ways. So the first is failure mode and effects analysis, FMEA, and that is we are going to identify the problem with a medical device or product before it occurs. So a way we do that is we perform preventative maintenance on all of our items within sterile processing. So when you perform preventative maintenance, you are ensuring that you are catching a problem before it happens. So that is FMEA. Now this is located on page 300 of your HSPA manual. On the flip side of that is what we call root cause analysis, or RCA. This is when there has already been a problem and now you have to backtrack to find where the problem occurred. So if you can identify the root cause where the problem initially happened, then you can prevent future occurrence. You can start to add in different quality assurance measures. And so this is found again on page 300 of your HSP manual. Please learn these two terms and get comfortable with them. They are a way that we perform quality assurance checks or analysis in order to prevent or to identify the root of a problem. All right, so now we're going to take a little bit of time and review a few case studies of medical errors within the sterile processing department. We are going to discuss a CRE outbreak and a Pseudomonas aeruginosa outbreak. Okay, so the first one we're going to discuss is because of a improperly sterilized duodenoscope. You will learn a lot about these type of endoscopes in your endoscopy class that you will take in your second term. So between 2012 and 2015, multiple hospitals in the United States reported outbreaks of CRE infections linked to improperly sterilized duodenoscopes. So these are used for procedures called ERCP, which stands for endoscopic retrograde cholangiopancreatography. All right, so the cause of the outbreak. So the duodenoscope is notorious for having a very complex design. When you see this instrument in your endoscopy course, which is your second term, you will understand why it is so complex and difficult to clean. So it has a design flaw right off the bat, which makes it very difficult to clean this instrument. Because you're not able to properly clean the instrument and get into all those crevices, bacteria and biofilm were trapped inside the small areas. This allowed over 250 patients to become infected or exposed to CRE. Now, CRE is especially dangerous because it has a mortality rate of up to 50%. So this FDA and CDC issued urgent warnings and updated the sterilization protocols for duodenoscopes. Sterile processors, some lessons learned and prevention strategies. After the CDC and FDA recalled the instrument and increased the instructions for use, we saw an enhanced sterilization techniques. So as we get to different types of sterilization methods, you'll understand how the hydrogen peroxide gas plasma sterilization works, but more importantly that most facilities switch to single-use duodenoscopes, which means one use and then you throw it away. Otherwise, they were using a more complex sterilization method, which means these duodenoscopes had to be improvised. They also had to be improved before they could be placed into this other sterilization method. Increased surveillance was one of the prevention strategies, which means at the end of the cleaning of these instruments and sterilization, they were culturing the ends of the duodenoscopes to make sure that there was no bacteria or biofilm left on these instruments. Next up is Pseudomonas aeruginosa. So this outbreak was due to contaminated surgical instruments. The outbreak occurred in a European hospital and affected 24 post-surgical patients. The infection was traced back to improperly sterilized laparoscopic instruments. So in this case, and as well as your CRE scenario, they used the root cause analysis method to backtrack to where the infection originated from. Now going forward, they would use the FMEA because they have preventative methods in place. All right, so the causes of the outbreak were inadequate cleaning of the instrument lumens, so the internal component. Those narrow channels were not properly flushed during the decontamination process, which means previous patients' bacteria, bodily fluids, tissue was still in that inner lumen portion. Biofilm formation was allowed to develop inside the instrument lumens because they were not properly being flushed and cleaned out. The hospital also was not following those manufacturer's instructions for use. So there's a specific type of time for drying that were not being adhered to, which means that moisture was allowing that bacteria to continue to grow as well as the biofilm. All right, so the impact of this outbreak, 24 patients developed surgical site infections. That's a pretty large number. Some of those patients required additional surgeries, and the hospital faced legal action and regulatory scrutiny for noncompliance. So not only did patients have to go in for multiple procedures, we had surgical site infections, which is an HAI, but they also faced legal action. So some lessons learned and prevention strategies. So proper instrument cleaning and sterilization. The staff was educated on how to properly flush those lumens and instrument channels. They also were shown how to use cleaning brushes and enzymatic detergents, as well as enhanced drying procedures. So to conclude our medical error lecture, you play a huge role in the prevention of medical errors. It's also important that there's collaboration between the sterile processing department and other healthcare teams, such as the OR. And there also should be a commitment to continuous improvement in patient safety. And this could be as simple as staff training and education, monthly or bi-weekly education trainings on new devices, or just refreshers on how to properly do certain steps within sterile processing.